Hey everyone, my name is Dr. Josh Stewart, physical therapist here at Stewart Sport and Spine Physical Therapy in Ankeny, Iowa. Today I want to talk to you about SI joint dysfunction. So with SI joint dysfunction, unfortunately is very prominent in our society and very underdiagnosed. It can be a little tricky to diagnose because of a lot of different clinical presentations. The main one potentially could be very similar to what we call sciatica, which is nerve pain that originates in your lower back and actually travels down your leg all the way down to your foot. With respect to SI joint dysfunction, this pain usually goes to right about your knee. Sometimes it can go a little bit lower, but usually it stops kind of right around that general knee region. Another common area for pain for SI joint dysfunction is right where that joint's located, where that hip bone and then the base of your spine meet and form that SI joint. So with respect to SI joint dysfunction, there are a few common movements that really provoke or aggravate that pain. First off, bending backwards, right where that joint is located is a very common area where that pain is present. Also bending forward in that same general region is another common aggravating movement. Sometimes that pain can actually travel down, as we previously discussed, to the knee, so it's a little bit tricky to diagnose. A few other common aggravating movements are rolling over in bed, sitting on a surface for a prolonged period of time, and standing for a prolonged period of time. Luckily for SI joint dysfunction, there's usually 1 to 2 common issues that are causing that pain. The first is what we call an upslip. So this is your hip bone, and this is the base of your spine. What happens is that hip bone slides up a little bit like so, or the second issue is what we call an outflare, where that hip bone actually rotates this way a little bit. Both of those can cause a compression force right here at that SI joint. So what we aim to do is pull that down and then also gap it open like that to relieve that compression force. So on average, to treat this condition, it takes about 5 to 7 weeks. Our goal here at Stewart Sport and Spine Physical Therapy is to treat you and teach you how to manage the symptoms even after you're done with the 5 to 7 weeks of therapy. My goal is to not see you again for this diagnosis in the future. It's all about you learning how to control and manage this on your own. So if these symptoms, and this sounds similar to what you've been dealing with for years on end, go ahead and reach out today for a consult and let's get started.